It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Hi folks, I'm Sam Lesante, and guess where I'm at? I'm at the new Hazleton General Hospital's Sleep Disorder Center. Now, just so you, for your information, the center that they had at across from St. Joe's is closed. So, but what happened? It got better. They went from 2 bedrooms to 4 bedrooms, and here at the Markle Building on the 4th floor in Hazleton, it's fabulous, folks. When you see this show, you'll know what I'm talking about. We're going to show you the rooms and what happens, all right? And now, also, I'm going to put a phone number on the screen because I know you're going to want to call for information. It's 501-1334. And throughout the show, we'll put those numbers up for you. Now, my guest today, we have Dr. Henry Smith, Jr., who is a board-certified pulmonologist and sleep medicine physician. We're going to find out what that means. And Jennifer Frey, who is a sales and marketing director with the Sleep Disorder Center. And Melissa Jones. She's the girl that's here all the time, watching and making sure that you're in good shape. She's a lead technician with the Hazleton Sleep Disorder Center. First of all, folks, thanks for coming on the show.
Thanks for having us.
Doctor, I got to tell you, I'm excited about this show because I think I'm a candidate for this, okay? And I see Jennifer, she's saying, well, we'll talk after the show, okay? But first of all, let me ask you this. For those people, I know you've been on all around the town and people know who you are. Tell us a little bit about, I know what a pulmonologist is, but sleep medicine physician, what is that?
Well, probably 20, 25, even 30 years ago, there was a recognition that we were kind of ignoring sleep as a problem that many people had. And over the years, a group of people, actually it came out of the psychiatry profession, but neurologists and pulmonologists also sort of spontaneously took it up throughout the country. And basically what's happened is we've developed a specialty. In our case, it's based on the internal medicine specialty for sleep medicine that encompasses a really wide group of problems, from the common sort of signature thing, which is sleep apnea, to the most common sleep disorder, which is insomnia, to more oddities like what we call REM behavior disorder or narcolepsy or some other things that actually are out there and are pretty common. And people may not either recognize they have them, or they may not understand that what they're going through at night is a sleep disorder.
Now, all of these things that you mentioned, okay, some people may, what are some of the symptoms, okay, of sleep disorders?
Well, I think there's 2 main categories of symptoms that you would talk about. One would be a person who's unhappy with their sleep. In other words, they go to the bed and they're not sleeping in a way that makes them happy. A second category of people are people who are sleepy during the day. People that have insomnia or believe they have insomnia may be perfectly awake and alert during the day, just not happy with the time they spend in bed. Whereas people who have a functional problem with their sleep, such as sleep apnea or narcolepsy, will be sleepy during the day. They will be falling asleep during the day. And this is obviously a big danger, especially if you drive a car, operate a motor vehicle, you drive truck, even worse. Those are important problems to ferret out and to fix. And they really make people's quality of life so much better when you do that.
Mm-hmm. So sleep apnea is what? What is that?
Sleep apnea is a broad range of problems that relates to the fact that for a variety of reasons people stop breathing at night.
That's not a good thing,
No, it's not. And in fact, it creates havoc with the body, especially if it gets severe. The most common kind of sleep apnea is called obstructive sleep apnea. That's a problem where the throat actually collapses at night. We often see it in people that have big neck sizes. Also, you can look at the back of the throat and you can see a lot of people don't have a lot of airway back there. And some combination of the tongue and the palate and the collapse of the lower airway leads people to have multiple episodes where they try to take a breath at night while they're asleep and they can't get a breath. And that sets up a whole cascade of problems, because every time you do that, the body releases a variety of hormones, including stress hormones, which tends to elevate the blood pressure, elevates your risk of stroke and heart attack, and also destroys what we call your sleep architecture, which is the normal pattern of sleep, so that when you wake up after 8 hours of doing this, you feel horrible. You haven't slept. You're tired. And over time, it actually distorts the body's hormonal system. It really plays havoc on the body. And it's so easy generally to diagnose it and to fix it. And we give people, a person who has excessive daytime sleepiness who has sleep apnea, when we fix their sleep apnea, they're so happy. You know, they're speechless. You know, they just feel so great.
Yeah. I have a friend of mine who swears by it, okay, and he had problems, and he's been, you know, he went for the test, and he's doing fabulous. So now, based on what you said, Jennifer, the facility itself, okay, what is this facility? How does this help with what the doctor was just explaining?
Well, you would come into the Sleep Disorder Center in the evening, unless you had a normal sleep pattern of during the day. Some people work swing shifts and they sleep during the day and they work at night. But mostly, for the most part, you come in at night. And you'll come in and you will be met by the lovely Melissa, or one of our other wonderful techs, and they will get you hooked up so that they can measure your brain waves, your respiration, your heart rate, any type of periodic limb movement, some restless leg syndrome. There's a multitude of things that we can measure while you're here. And it's really a very benign test. You're not medicated in any way. You're not going to be altered in any way. You can leave the next day. You can shower here. We have a very nice shower, and go off to work, or you can go home if that's what you do. And what I can express to people is there's nothing to be afraid of. It's a really wonderful tool to not only diagnose, but also to rule out. And for most people, it's a little vacation away from their spouse. Our facility is, as you said, a 4-bed laboratory. We also have our waiting room. We have a technician room where all of our equipment is, and where the technicians watch the sleep studies and see what happens. We have, like I said, 4 bedrooms, so you'll be shown to one of your bedrooms and you'll be set up and get comfortable. And the building, the Marco building, has a long history in Hazleton for most people who've lived here.
Beautiful building.
It is a beautiful building, and there's a restaurant downstairs, to give them a little plug, Mia's. So if you want to make it a date night, come down, have dinner, and then come up for your sleep study.
And the food is excellent.
It
It's
is
fabulous.
It is, but don't have a drink.
No, that's
Don't.
it.
I know. That ruined it for you.
So why do you say that? Because it affects...
Yes, alcohol will actually relax your muscles and will not give you a true sleep study. You shouldn't take, a lot of people that I've met have said they take a couple of drinks to go to sleep every single night. And that's not a healthy way to go to sleep either. It's not a real deep sleep you're going to get while you're intoxicated.
So doctor, what would be some of the symptoms that, you know, someone would have to say, you know, I have to go for this study?
Well, we talked about daytime sleepiness and loud snoring. As I have often said, generally a big reason that people come to the sleep lab is because their spouse is eager for them to be studied. Because one marker for this is, for instance, is a spouse that won't sleep with the affected spouse because they just can't stand the snoring.
Debbie, you didn't hear that.
And very often when patients come into the
So
office.
anyone who snores, you're saying anyone who snores has to have a test?
No, not
Come on,
everybody,
give me a break now.
No, not everybody that snores that has a test, because there are other things. Wives bring their husbands in all the time because the wife will say to me, I hear him stop breathing at night. Or there's kind of a snorking sound that people make. They make this sound intermittently while or there's another form of sleep apnea called central sleep apnea, where you actually, it's not so much the airway blocks, it's that your brain doesn't tell your lungs reliably to breathe at night. So these people the spouses will just notice there's no breathing going on. And they'll push them, they'll often tell you they poke them, and they'll start breathing again. And that's what we do in a sleep disorder center. We try to sort out, is there a significant amount of what we call sleep disordered breathing? Because everybody has a little. Everybody will have an apneic episode, once or twice in an hour, and that's not a treatable problem. We're looking for the people that have them 10 and more times an hour. And so we bring people in, we decide if they have obstructive sleep apnea, is there a problem with central sleep apnea? And if so, is it of sufficient severity to treat?
Okay, now, I'm a big baby. All men are big babies, okay? So when you're talking about tests, we all get nervous, all right? I'm going to come here and I'm a nervous wreck because maybe I snore and maybe I have some of those symptoms, okay? How scared should I be? How do you relax me, okay, so I'm not going to be a big baby?
Well, I guess there's a couple of issues. Number one of the things we cope with is that some patients will tell you right off the bat, and I always ask this question, how do you sleep in a hotel room? Some people can sleep, a lot of people with sleep apnea will sleep anywhere, but there are still people that have problems in strange environments. And there are people that, you can just tell are anxious about the whole thing, and it's not uncommon. There are certain types of sleep aids, sleep medicines, that don't affect the breathing in sleep. And we'll often give them a prescription for 1 or 2 pills of those to use when they come in, so that because we do need them to record a good night of sleep. If they have a night where they're tossing and turning and they're getting little sleep, it's very non-diagnostic. You can't really know what's going on.
And that would be the concern that people have, is that, you're in a strange place, you're going to, and then we'll talk about how you do, Melissa, or Missy, Melissa, how what you do in here, and we'll show them, what happens. Because now I'm going to be confined, I'm in a strange space, I'm nervous, I'm going to be tossing and turning, and all these things go through your mind, and then what if so how do you comfort me?
Well, I think you first off, we made
because I need help, Doc, here.
The sleep lab is a pretty comfortable environment.
It's beautiful. It's very, very nice.
I think the first thing you do in a situation like this is we try really hard, and the industry has tried really hard, to allow us to create sleep rooms that are as little intrusive as possible in terms of looking clinical. I mean, if we had you in a room full of clinical equipment and monitors and things, you'd never be able to sleep. You can see that the equipment's very non-intrusive. It's there, you're going to be wired up, but for the most part, we want you to be comfortable and feel like you're sleeping in a normal bedroom. And so that, I think, is one element of this. Mm-hmm. And again, I think that if you have somebody that is just absolutely horrible when they try to sleep out of their home or out of their environment, then you help them with a number of, there's a few medications, as I alluded to, that don't affect the breathing at night. There's certain sedatives we can't give you. Mm-hmm. Jennifer talked about alcohol, which does make the sleep disorder breathing worse and alters your sleep architecture. Every once in a while, if somebody is a drinker and we know we got to treat them, I'll let them have a beer before they go to bed, because in some ways you almost have to mimic what their daily life is like. Mm-hmm. But we prefer not to, because it does worsen the sleep study.
What happens during a sleep study, and what does it determine?
Well, to touch on what Dr. Smith was saying, to make our bedrooms, really comfortable. They're full and queen size beds. You're not sleeping in a hospital size bed, and the rooms are decorated quite wonderfully so that you can feel most comfortable. So you'll come in and you will be, if anybody's ever had an EEG before, you're going to have a couple of wires connected to your head, and there's going to be something called a nasal cannula, which goes right under the nose, which is going to measure your inhalations and exhalations.
Yes.
And we're really looking to see exactly what happens to you from the moment your head hits the pillow until the moment where your alarm goes off or you get up to go to work. Because people will very adamantly say they know what happens to themselves when they're sleeping, which is physically impossible.
Once you come in, we would show you to your room. There are approximately 18 gold cup electrodes that we will place on your head.
Did they hurt you?
No, not at all. It is non-invasive whatsoever. It's actually very sticky. We use what's called 1020 paste. It's a conductive paste that allows us to place the electrodes on your scalp, very close to your scalp, without having to poke or prod or anything like that. They monitor seizure activity, your stages of sleep, your eye movements. Do you sleep with your mouth open, closed, grind your teeth, things like that. You will also be wearing gold cup electrodes on your legs. They check for the PLMs, or the periodic leg movements, restless leg syndrome. You also will be wearing 2 belts, one across your chest and one across your abdomen. They allow us to actually watch every breath you take or don't take.
And here again, this is not intrusive. It's not going to be,
no,
even though they're seeing all these wires now, okay,
right.
It's just something that it's a normal procedure, and it's not intrusive. It's not going to get me or anyone else nervous about it.
No, absolutely not. It's like Jennifer said, it's very minimal, non-invasive whatsoever. Once all the wires and everything is placed, we plug them into a small little head box, which, like you were asking in regards to the restroom, that head box is then plugged into a long cable next to the patient's bed. We have intercom systems in our bedrooms. We are able to visually see you and hear you for the entire study. So if you do need to use the restroom, or you are feeling a little uneasy, or you just need to get up, stretch your legs for a minute, simply all you have to do is talk. There is no nurse call buttons, anything like that.
Okay, so a person, again, they're always apprehensive, okay? They're always nervous about coming in. So what we're trying to do is make that person realize that this is a safe test. It's something that's good for them. It's something that's going to help them, okay? Now, the person has the test, okay? What are some of the things you discover? Let's assume they have sleep apnea, or what are some of the things that you could discover from these tests?
Well, again, I think that you can discover, the first thing you discover is whether or not they slept.
Okay.
And whether or not they sleep with a normal pattern of sleep. In other words, we have multiple sleep stages that we all go through at night, and you want to see whether the people have a normal a sleep period. If somebody is complaining of daytime sleepiness and they got 3 hours sleep in the sleep lab, it doesn't tell you a lot sometimes. We're looking at their electrocardiogram, which is sometimes you'll see arrhythmias at night. We look at their blood oxygen level. People with respiratory problems will often have, and with sleep apnea, will often have their oxygen levels fall fairly profoundly at night. We look at their, as mentioned, we talk about their, you talk about air movement, the breathing sort of channels in the display are the airflow, or the air pressure, the chest and abdominal motion, and that's how we diagnose apneas and what type of apnea they have. And then
There's different types of apneas?
Well, as we mentioned, there are apneas where your brain just doesn't tell you to breathe.
Okay.
And there are apneas where your airway obstructs. Okay. Your brain is telling you to breathe, but your airway has collapsed and you can't get a breath. And it's those that are the most common. Again, of all the things we see in a sleep lab, the two most common things are obstructive sleep apnea and what we call periodic limb movement abnormality, which is where people jerk their legs at night and it can arouse them and it can ruin their sleep.
Folks, if you just tuned in, I'm talking to Dr. Smith, Henry Smith Jr., who is a board-certified pulmonologist and sleep medicine specialist, physician. Jennifer Frey, who is a sales and marketing director with the Sleep Disorder Center here, and I'll tell you where it's located. And Melissa Jones, who's a lead technician. She's the girl that'll be here when you come for your test. Now, if you remember, they had the center across from St. Joe's. That is closed, but it got better. 4 bedrooms, beautiful place here in the Markle building downtown, 501-1334. And okay, so someone's watching this saying, I know what's happening. People are watching this show saying, "See, I told you. See, I told you. See, I told you." See, I know that's going to happen. So, "See, I told you" goes to what does the person do when they say, "See, I told you"?
Well, I think you want to go to. I think you want to find your first person to go to is probably your primary doctor.
Okay.
And talk to them about it. I think, and I sometimes, I've had patients who I take care of, for instance, for asthma or COPD, and I missed the fact that they didn't complain to me, and I missed the fact that they might have a sleep disorder, and somebody else orders the sleep study, and we discover that it's true. But I think you have to go to your doctor, and you have to realize that. Even though as we get older, our sleep gets more disrupted. You don't sleep like you did when you were 18 years old. It's normal as an adult to have more fragmented sleep, to get up a time or two a night, to not have that deal where you just hit the pillow and then the next thing you remember you wake up in the morning. Adults don't do that. So a certain amount of sleep fragmentation is normal. But you should be well rested during the day. And if you're not, then something may be wrong.
Okay, a couple questions. You have other doctors working with you here, right?
We do. There's 2 other pulmonologists that read studies in the lab, Dr. Jim Martino and Dr. DJ Patel.
Okay. Now, you mentioned about age, okay? Mm-hmm. Let's assume, what is a certain age that you do not qualify for? As far as coming here, an age barrier?
Well, I would say probably 12 and up would be.
Well, we only take 18 and over here at this lab. There are 18. You can have sleep apnea if you are under 18.
And so, okay, so this is not age. In other words, let's say, only people who are over 50, over 60. There are people who maybe in 20s or 20 who have this problem, right?
It actually is an interesting question because you can have this problem first off, there are 2 peaks, or I shouldn't say there are 2 peaks. There's a peak in childhood. So anywhere between 8 and 12 is the peak in childhood. Sleep apnea in kids tends to be caused by tonsillar problems, tonsils and adenoids. And when you take the tonsils and adenoids out, it goes away. Then there's sort of a gap. And now with our increasingly obese society, I have 25-year-old guys coming to my office that are 350 pounds. And anything that puts a lot of weight on your chest and puts a lot of weight around your neck and gives you the risk of sleep apnea. Mm-hmm. So that it can be, we're seeing very young people who because of the obesity epidemic, are coming in more and more to see us.
So now, what are some of the things to make me feel better? Okay, what will you be describing? Now, what is this, a mask?
The most first off, let me just say that if you have very mild sleep apnea, there may be some modest things you can do that are not so bad. For instance,
Drink more.
Well, no, drink less. No, drink less, and sedatives and narcotics all can make sleep apnea worse.
Okay.
So if we can minimize those things, that helps.
Okay.
The other thing that can make sleep apnea, the other thing is position. If you're laying on your back, and you probably know this, if you snore, and you lay on your back, not you, because I do. I have this problem.
Why am I doing this show? I have no idea.
If I lay on my back, I snore.
Yeah.
And my wife hits me in the side, and I have to roll over, and this can happen multiple times a night.
You need a test here.
Well, no, I do. I've already tested myself. I know that I don't have significant sleep apnea, but I just snore. So we actually have devices, and there's tricks that you can do. A classic is what we call a tennis ball and a T-shirt, where you you tell a person if you're going to sleep, and if all they do is have events when they're on their back, and if their disease is very mild, you can tell them to take a tennis ball, take a rubber band it into the back of a T-shirt, and wear the T-shirt at night. And what happens is when you roll on your back, the tennis ball's there, you roll back off it again.
Okay.
And there's actually a doc from Philadelphia who's created a device that mimics that. But of course, this is a much less expensive way to do it. So things like that can help. There are dental appliances that are expensive, and they're helpful in mild sleep apnea. But they basically what they do is they force your jaw out a little bit, pull your tongue away from the back of your throat, so your airways improved.
Well, you're making this really exciting. But they're not that. I mean, okay, what is this now?
This is a CPAP, or I should say a positive pressure mask.
Okay.
It basically works as this would be attached to a device that is a little mechanical ventilator.
Yeah.
And it would sit at your bedside, and you wear this at night. And what it does is once we've diagnosed you with obstructive sleep apnea, we would bring you back to the lab, and we would put one of these on you, with the instrumentation in place again, and we would apply this therapy, and we would adjust the pressure. Somebody like Melissa would spend the night watching your sleep, watching your breathing, and adjusting the pressure to find the optimum pressure to put into this mask to keep your airway open so it doesn't collapse. These are very soft rubber. You wear them. There are hundreds of different forms of these masks.
So I'm claustrophobic. Okay. So with this, so therefore
have you covered.
You have it covered. No, really, I'm a claustrophobic. I tell you, I'm a sad case here.
Then you might benefit from what we call nasal pillows.
Okay.
Which do not have an envelope.
Now they both work the same way.
They do. They provide you with pressure in your airway to splint your pharynx open and to splint your airway open.
Okay.
Right.
And these are some, and then what happens is a person starts getting the proper rest, okay? So if a person is obese or has high blood pressure or whatever, these are things that could help reduce them. No guarantees, but it can help reduce them, correct?
Right, it is true. And actually what's interesting is if you have high blood pressure, your blood pressure may come down on treatment because of that you're not getting bombarded with that adrenaline all night like you were when you were having events. People who have sleep apnea have a terrible time losing weight because A, they're sleepy during the day, so they don't want to do anything, and B, they have some hormonal imbalances that cause them to be somewhat insidiously. Sleep apnea kind of feeds on itself. It creates a hormonal situation where it's hard to lose weight. And once you get treated for sleep apnea, it may be easier to lose weight. If you have a risk of stroke or heart attack, if you have significant sleep apnea, meaning 20 more events a night or 20 more events an hour, then you actually get an advantage in terms of your cardiovascular profile. Your risk of stroke and heart attack goes down with treatment. If you're tired, you want us to find that you have sleep apnea because it's fixable.
Everybody who I know who has gone through the test and has they swear by it. They just definitely swear by it. I think it's always the initial nervousness of going
like
through
anything.
tests. Who likes tests? Who likes this, etc. But it's like you said, as we saw. Don't let all those wires. Have fun with it. Really. Just have a little fun with it. Other than having and say, oh, my electrocardiogram. You don't have all these things, and people are. First of all, they don't want to be in situations, but we're trying to help them.
Well, let me just say this too. I don't want to put too. I want to be realistic about things. There are a certain percentage of people that don't initially tolerate this therapy for reasons of claustrophobia, for reasons they don't like pressure in their airways. And what we know out there is that in the past, a lot of people were put on this, and I run into it all the time when I meet new patients, that they say, oh yeah, I have sleep apnea, but I got that thing and I never used it. And the problem is that there's actually a sophistication to understanding how to help people tolerate their device. And there are other devices. The device we've been talking about is called a CPAP. But there are more sophisticated bi-level devices that are more comfortable to wear. They're more expensive, and the insurers make us walk the dog a bit to get them for people. But that's an option for somebody that doesn't tolerate a plain CPAP.
That's fabulous.
So that you're not done if you got one of these devices prescribed for you and you went home and you tried it 2 or 3 nights and you can't use it, you shouldn't consider yourself done. There are other options.
Before I wrap up, I know a friend of mine who travels a lot, okay, and he was in Italy, and I happened to see him in Italy, etc. And he brings they bring them with them. They're very easy. There's nothing, they just pack them up and you take them with you, okay?
They're very portable.
Yeah, very portable. And what is it? Were they giving you, what is it?
Just pressure and air.
It's just pressurized air. It's room air, filtered, cleaned. That's it.
Yeah. Well, I'll tell you, for those people who have, these symptoms, either obesity or if they're having difficulty, but you're right, the spouses will tell them, and I know it's happening. You see what I told you, which is great. And the facility here is fabulous. And once again, I'm not surprised because the Greater Hazleton Health Alliance is just raising the bar. Anything in closing, anyone would like to say to our viewers?
Well, I guess what I'd say is that if you have a problem with sleep, it may not be normal, and there may be a fixable problem. And you ought to avail yourself of therapy, and we'd like to be the ones to help you, frankly.
Well, I won't see any reason why not. Well, listen, Melissa, I guess you're going to be seeing a familiar face here pretty soon.
I hope so.
Okay.
I look forward to it.
He has his own television
really
show. Okay. He owns a television station. Okay. Because I'm definitely a candidate for at least a test. Okay.
I look forward to it.
Okay. And treat me nice because
I will,
I'm a
I
big
promise.
baby. Jennifer,
I promise.
Jennifer, thanks for being on
Thank
the
you
show.
for
Okay.
coming.
And Doctor, it's always a pleasure. I haven't had a chance to meet you, but I always saw you all around the town. And it's a pleasure.
It's nice to meet you.
Okay. Folks, as I said, I'm here at the Hazleton General Hospital's Sleep Disorder Center. It is the new place. Now, remember, St. Joe's had 2 bedrooms. It's closed. We have 4 bedrooms here. It's a beautiful place. And if you need their services or you want to find out more, 501-1334. I can tell you right now, you know who you are and you know if you need them, okay? Once again, folks, I've said this many times, and I'm always thrilled to say this, the Greater Hazleton Health Alliance, okay, their doctors, their physicians, the helpers, everyone from this receptionist on, and all of the divisions do a super job. And it's interesting because you have people who come in here and say, the story before was many years ago, we have to go out of town. Well, now we have people coming in from out of town here. And that's really great. Okay, so we have the great health system here. Take advantage of it. We'll see you next time on the Sam Lesante Show.